A4.3, those in public and private, wet and dry market vendors, and also the frontline workers in grocery, supermarkets, and also yung delivery services doon sa, ano na yan, sa grocery na yan. A4.4, workers in the manufacturing for food, beverage, medical, and pharmaceutical products. Kasi tingin namin itong kailangan din natin i-secure, no? Yung food natin and also yung medical and pharma needs. A4.5, frontline workers in food retail, including the food service delivery. A4.6 are the frontline government workers. So dito nakasama yung mga safety inspectors natin. Dito kasama rin yung mga PSA na field enumerators who really have to go house to house, and all those who are involved in the PhilSys registration. Kasama rin yung mga nasa mga sa tax, sa clearances, because again front facing itong mga workers na ito. Next, 4.7, frontline workers in financial services. So yung mga nasa banks, yung sa mga money padala, but we're looking only at ang considered nandito yung mga frontline workers. 4.8, teaching and related personnel in medical and allied medical courses of higher education institutions, including personnel handling laboratories, because kailangan hindi sila makapag-online classes, so we also need to protect them. A4.9, the frontline workers in hotels and accommodation facilities, especially since many of these are actually doubling as quarantine facilities, or sila ang kagad pinupuntahan muna ng mga ano natin, returning overseas Filipinos natin. A4.10 are the priests, the pastors, religious leaders regardless of denomination. A4.11, construction workers in government infrastructure projects. A4.12, security guards and personnel assigned in the establishments, offices, agencies, and organizations identified in this priority sectors. And then A4.13, OFWs not classified above and who are scheduled for deployment within 2 months. So yung mga OFWs natin na kasama sa commuter transport, nandun sila sa A4.1. Okay? So yung mga commuters natin nasa food retail service, kunwari, mga hotels na pero abroad, kasama rin sila dito. So for this particular group, we're thinking that there will be a closer partnership with the establishments, agencies, and organizations. So we refer to them as the EAOs. So first, they are encouraged to widely disseminate this information to their workers and personnel. Next is the EAOs shall issue a certificate of A4 eligibility, whether employment, deployment, or assignment to their workers or personnel who belong to the A4 priority group. Kasi like I said, kunwari financial services, it's a bank. We will only consider muna yung frontline workers, the bank tellers, yun, mga security guards nila, yung mga ano. And this certificate can be signed by any of the following, the owner of the establishment or the highest ranking personnel of the agency or organization with office located in the LGU, or the head of the HR unit. And then the EAOs are also advised to adopt a schedule system for their workers, taking into consideration possible adverse reaction of vaccines. So staggered ang schedule system that they are advised to follow, and the workers will register for the appointment with the advised schedule of their employer. And then we also hope that these EAOs can provide the logistical support, including transport, to facilitate yung vaccination of their workers. And then coordinate, of course, with the LGUs for the vaccination. The more detailed guidelines is actually being developed by the DOH, the NITAG. But these are the inputs that we have provided to them. And so that's my presentation. Thank you very much.
Thank you, Yusek Rose, for presenting the recommendations of NEDA with regard to the A4 population. Yusek Rose, I'll be opening the floor for questions to our media with regard to your topic po. There's a question here from Red Mendoza of the Manila Times. To Yusek Rose, the HPAC said that the loosening up of restrictions can be dangerous as we have not built up our health system capacity during the ECQ. What does the NEDA think about the comments made by HPAC? And when will this frontline group be implemented? Has this been presented to the IATF po? Yusek Rose?
Yes, thank you. First of all, with respect to this A4 priority group, this has been presented to the IATF and also presented to the DOH NITAG and also the NVOC. Yan. So na-present na siya, and this has actually already been approved by the IATF as well. But like I said, the detailed guidelines will be is being developed by the DOH para consistent with the other operations. Now, with respect to the kumbaga de-escalation no ng ating quarantine classification, the decision really is to balance everything, no, considering na this maintaining the ECQ actually comes at a very high social and economic cost. And then ang isang nakita rin is kailangan talagang parang kailangan talagang i-improve yung health system capacity. So you provide more ICU beds, kasama na dyan yung sa healthcare workers, kasama na rin yung mga isolation and quarantine facilities. We know that all this also come with a cost, pero nakita namin na mas kakayanin natin to kesa mas malaki pa yung magiging social and economic cost. Like I said, tinitingnan namin yung gaano karami ang mawawala ng trabaho with this additional week of the ECQ, ilan pa yung magiging mga increase in poverty and increase in hunger. So it's really about balancing. And in any case, like I said, nandyan din talaga yung kaya mabilis din ang response ng IATF na improve natin ang ating health system capacity. Thank you.
Thank you, Yusek Rose. A number of our media partners would like to confirm if kasama daw po ba ang media sa A4?
Yeah, thank you for that. I think it will now be up to the IATF. So as per the recovery cluster, ang tiningnan kasi nga namin yung mga those who cannot have their own bubble, those who cannot work from home, mga ganang tipo na sectors. But my suggestion is ang final say naman nito is the IATF. So doon nila i-propose. Thank you.
Thank you, Yusek Rose. Just like further clarification po from Sophia, if media is not part of A4, would you happen to know what group they will fall under po?
I'm not really sure. Baka si Yusek Rosette would know.
Yes po, Yusek Rose. Media would be part of the B classification already, together with the other workers in our society. But as what Yusek Rose have mentioned, if this will be discussed in the IATF and resolved na isasali, and then that would be something that we need to change or include into this framework that Yusek Rose has just presented.
Thank you, Yusek, for the clarification po. From Deo Calonso of Bloomberg to Yusek Rose, does the NEDA already have an estimate on how much the MECQ until end of April will lower our GDP this year?
That is something that we will be discussing in the DBCC. Hindi ko matandaan kung bukas or Wednesday, no? Basta this week, and we are crunching the numbers actually. Thank you.
Thank you, Yusek Rose. I believe the question of Sophia has already been answered by Yusek Rosette. If there are no more questions for Yusek Rosette from our media partners, Yusek Rose, we ask for your reminders put to the public from the NEDA. Salamat po, ma'am.
Yes, thank you very much. Again, just to reiterate, no, the basic principle that we are following in this vaccine deployment program is one, it's still the PDITR that is the cornerstone response. Siya pa rin talaga yung ano natin kasi we know that this vaccine deployment will take time. In fact, after you get your first dose, you wait another 4 or 8, baka 12 weeks pa to get your second dose, and then after 2 weeks pa, tsaka pa lang talaga siya magkakaroon ng full effect. So it really is really the big responsibility, no, of individuals to maintain compliance to the minimum public health standards. And with this A4, we hope that this will really help in protecting the most vulnerable in the economic sectors, and as such, it will really be a big help in safely reopening the economy, which is gusto na rin natin mangyari. Thank you.
Yusek Rose, just a follow-up po from our media partners. Last na lang po, if you would know when we will start vaccinating the A4 sector po?
We're looking at again, hindi pa kasi ganun ka definite, no, yung pagdating ng supply of the vaccine, but I think the best case scenario is we can start in May, pero it can actually slide to mga June yun, and we think, of course, there's that first and second dose, so it can be June, July, August. Thank you.
Thank you, Yusek Rose. Yusek Rosette.
Yes, thank you very much, Yusek Rose, for accommodating our invite and explaining to our media partners and the public about the A4 group for our priorities for vaccination. Maraming salamat po, Yusek Rose.
My pleasure, Secretary, and
Thank
the DOH family.
Thank you po, Yusek Rose. We will now be moving on to the DOH questions. Yusek, I'll start po with the question of Pons Pagsampol of Rappler. With most cases of new COVID-19 variants are local, and given the surge in infections, can we say now that we have the community transmission of this new virus types?
Well, hindi pa yan natin masasabi, Bons, no? So usually kapag nagde-declare tayo ng mga levels of transmission dito sa ating bansa o sa iba't ibang lugar, we have WHO to work with us, no, based on parameters and based on appropriate and adequate contact tracing. Kasi kung matatandaan nyo, babalik tayo, para masabi natin na community transmission, wala na tayong nakikitang link from the individuals who gets this variant among the community or among the neighbors, no, or mga kamag-anak nila. So sa ngayon, offhand pag tinignan natin yung analysis, nakikita pa rin natin na may mga linkages. But of course, yung WHO, tinutulungan po yung ating mga epidemiology units para makita talaga yung linkages nito with that analysis together with the Philippine Genome Center. So maybe in the coming weeks, we are going to be able to give this information to all of you already.
Thank you, ma'am. From Lay and Andreo, they're asking updates po with regard to the planned use of the incoming shipments of AstraZeneca vaccines from COVAX, as well as yung protocol daw po for those under 60 who were already vaccinated with AstraZeneca. Will their second dose be the same vaccine, or will the DOH recommend a different one po?
Wala pong nabago sa ating mga shipments. Walang nabago sa plano. If we are still going to get AstraZeneca, it's still going to proceed as planned, no? Kung ano man po yung inaantay natin na shipments ng AstraZeneca, patutuloy po yan. Marami po ang nagtatanong. Sa tingin ko po, kailangan lang nating klaruhin, ang AstraZeneca po, hindi po natin sinuspend completely. We said we are going to temporarily suspend as precautionary measure. Kasi di ba meron hong mga lumabas na mga ebidensya na nagsasabi that there is this specific event na nagiging adverse event ng ibang mga kababayan, mga ibang tao sa ibang bansa. And because of this information, the Food and Drug Administration decided, no, that we should just temporarily suspend para lang mas mapag-aralan ng ating eksperto. The suspension is for us to evaluate. The suspension is for us to coordinate with the manufacturer and WHO so that we can add extra precautions pag po pinatupad na natin uli ang AstraZeneca. Hindi po ititigil kung hindi magdadagdag lang ng extra precautions para mas guided po ang ating pagbabakuna. So for those who have received the AstraZeneca vaccine as their first dose, hindi po natin kailangang mag-alinlangan. Hindi po natin tinitigil ang atin pong required time as interval for AstraZeneca vaccine would be from 8 to 12 weeks. So matagal pa ho yung pang second dose natin. Kaya it is an opportunity for us to reevaluate while we wait for those who have received it for their second dose. So hindi ho dapat natin pag-isipan na matitigil completely. And the concept on mixing brands, like you receive AstraZeneca now and then the next time around you'll receive another one, wala pa hong sufficient evidence to say that we can already mix brands, no, ng mga bakuna. So ngayon, yun pa rin ho ang ating posisyon at ng posisyon ng ating mga eksperto and FDA that whatever brand you have started with na nabakuna sa inyo, yan pa rin yung second dose nyo.
Thank you, Yusek. From Jocelyn Domenden of Remati News Online, former Senate President Juan Ponce Enrile admitted that he and his family also are taking ivermectin and nothing happens to him. Sabi rin na bakit hindi mag-experiment para sa alternative remedy for COVID-19, kaya nga daw po mayroong DOST to do the research. And ang ivermectin daw po ay hindi diniskubre para sa hayop kundi para sa tao to cure river blindness. What is the DOH comment daw po on this?
Precisely the point, no? So ang ivermectin has been registered for a lot of years already to cure other diseases. Pero para sa COVID-19 po, wala pa ho tayong sufficient evidence to say na pwede natin siyang gamitin at ito ay makakatulong at makakapagpagaling o makakatulong sa pagpapagaling ng ating mga kababayan. Ang DOH po, hindi po natin kinokontra, hindi ho tayo sarado para sa mga investigational drugs para magamit dito. Ang sa atin lang, let's put it in that appropriate process, the scientific process. Kaya nga po, kailangan pag-aralan pa ng mas maigting, no? Further studies are needed because for now, the current studies show wala po siyang epekto para dun sa pagpapabagal ng progresyon ng sakit, wala siyang epekto para ma-early discharge ang isang pasyente, at wala rin po siyang epekto dun sa mga pagkakamatay ng pasyente. And this is something that we take note of and our experts are recommending na pag-aralan pa mas further, baka mas makakita tayo ng sapat na ebidensya na talagang pwede nating gamitin. But for now, let us stick to our process at mapakinggan po natin kung ano yung sinasabi ng siyensya. Another thing, wala pa hong rehistradong produkto ng ivermectin dito sa atin na pwedeng gamitin sa tao. Currently, ang ivermectin po na naka-register sa ating bansa are still for animal use, no, veterinary products. But we don't say na porke yan yung nakarehistro ay hindi na pwede gamitin sa tao. Ginagamit po yan sa ibang bansa talaga. Pero dito lang talaga, we need to do the regulatory process. Pag nangyari ang regulatory process na yan at nakita naman ng DOH po na acceptable naman na at magbibigay ng ganyang protection, and then we will use it.
Thank you, Yusek. From Sheila Crisostomo po of the Philippine Star, according to Senator Amy Marcos, private companies are required to apply for a certificate of A4 eligibility before they can buy vaccines for their workers. Is this true po? If yes, what's the reason for this? And hindi po ba ito makakadelay ng vaccination?
I think Yusek Rose explained it a while ago in her slides. Nakalagay po doon ang mga workers ng A4 just needs to be given by their establishments this certificate of eligibility. This is something na kailangan din naman pong gawin, and this is also protection of the establishments and the companies na itong mga empleyado nila sigurado mabibigyan itong bakuna na ito. So ito po dahil nga po tayo ay magkakaroon na di pa ng A4 na listing and we will start. This is just to ensure that we are really vaccinating those who are really belonging to this A4 priority list. Pero sa tingin ko po, hindi ito magiging delay kung gagawin na natin ngayon pa lang. So, hinihikayat natin lahat ng mga sinabi kanina ni Yusek Rose na kasali dyan sa priority listing na yan, i-master list nyo na po yung mga empleyado nyo at bigyan nyo na po sila nung nire-require ng National Economic and Development Authority na certificate para lang po pag dumating yung panahon na mag-uumpisa na, hindi na po ito maging cause ng delay ng pagbabakuna.
Thank you, ma'am. From Red po Edona of the Philippine Daily Inquirer, same related question po sila, Yusek. The China Centers for Disease Control admitted effectiveness or efficacy rate of Chinese vaccines is low. Will the DOH continue the use of Sinovac vaccines and why po?
Kailangan tayo very cautious tayo sa interpretation. Although the CDC of Chinese government has apparently issued this statement, ang eksperto natin, lagi nilang sinasabi yan, it's very dangerous for people to be comparing the efficacies across these different vaccines, di ba? So halimbawa, sinabi mo ang Sinovac, ito ang efficacy, ang Pfizer, ito ang efficacy. Kailangan natin tignan din yung mga clinical trials kasi na naisagawa kung bakit lumabas siyang ganyang efficacy. So having said that, ang ating primary objective why we are vaccinating people is for us to reduce the number of deaths and severe cases, for us to save lives, no? So kung halimbawa, itong Sinovac na sinasabi from the Chinese government, the efficacy for mild disease would be about 50 to 60%, pero ang efficacy naman niya for severe would be 90% and more. And almost all of the vaccines right now in the global market, no, itong mga ginagamit, lahat yan, yung kanilang efficacy against severe disease ay mataas. At iyan po ang objective ng bawat bansa ngayon. Bawasan natin yung mga namamatay, let's help save lives. Yan po ang ating very objective. Wala naman po talagang bakuna na nagsabi na makakablock siya ng transmission. So, ibig sabihin, kahit nabakunahan tayo, we can still get the infection. Pero the promise of the vaccine would be that there would be lesser chances for you of getting hospitalized, lesser chances for you of getting this severe form of the disease, and lesser chances of dying.
Thank you, ma'am. From Leigh Alves of GMA News, may ilang kaanak ng mga namatay na confirmed and suspect COVID patients ang nagsabing mild to moderate symptoms lang ang naramdaman ng mga ito, kaya hindi agad sila dinala sa ospital. Pero matapos daw po na ilang araw ay bigla na lang nahirapang huminga at nang dalhin sa ospital ay huli na. Ano daw po ang mapapayo ng Department of Health sa mga taong nasa bahay lang dahil wala ring mapuntahang ospital? May naobserbahan din po bang pagkakaiba sa manifestations ng sakit ngayong may bagong variants na?
Yes, actually, bawat sakit naman, it starts with the mild disease. No? So, halimbawa, dito sa COVID-19, mauuna yan, maglalagnat ka, magsisipon, mag-uubo. Ang pinaka mabuting ginagawa ng ating mga kababayan, as soon as you experience the symptoms, of course, you have to isolate. Make use of the telemedicine providers so that doctors are guiding you on what you're supposed to do. Mahirap po talaga ang sitwasyon natin ngayon. Challenge tayo, that we cannot easily go to the hospital and have our assessment because our hospitals are really very busy right now. Pero maganda po na nabe-break natin yung chain na yon, na guided na tayo, nasa bahay pa lang tayo. And in fact, yun pong mga telemedicine providers na yan, libre po iyan. May 6 po tayong providers na nakuha ang DOH, kapartner natin sila. At everyday, pinopost ho namin ito sa mga websites namin so that people will easily access, at alam nila kung paano sila makakapag-connect dito sa telemedicine. So our advice to our citizens, kung nasa bahay po kayo, meron po kayong mga simptomas, as soon as you experience the symptoms, mas maganda, makapagpa-check up tayo sa telemedicine provider. Kung hindi naman po kaya sa gayon, tumawag po tayo sa Barangay Health Emergency Response Team so that the doctor in your local governments can also check on you. It is also handy na meron po tayong pulse oximeter dun sa bahay natin. Ito po ay isang maliit na instrumento na ikinakabit sa ating daliri at nami-measure po niya yung ating oxygen level sa ating katawan. At sinasabi na nga po ng ating mga eksperto, kapag ang oxygen level is below 90 already, you need to seek consultation in a higher level facility katulad ng ospital. So ito po mga bagay na ito, para mas nauunahan po natin ang paglala ng sakit, ay magandang nagagawa po natin para hindi po tayo nagkakaroon ng mga ganitong sitwasyon.
Thank you, Yusek. From Greg Gregorio po of TV5, what is the DOH initial assessment of the recent weeks under ECQ?
Well, unang-una, Greg, ang tinitignan natin lagi, number of cases and the healthcare utilization. As to the number of cases, we cannot still see this decline that we expect for this week or maybe in the coming week. Makikita natin yan mga 10 to 14 days after we have done doing this ECQ. So kung last week tayo natapos ng ECQ, give it another 10 to 14 days and we can see if really cases will decline. Second, for the healthcare utilization, syempre yan yung ating talagang minomonitor. That's very important for us right now. Ang kagandahan Greg, habang tayo ay nag-ECQ, nakagawa tayo ng mga paraan at mga hakbang para mas ma-expand natin ang kapasidad ng ating healthcare system. We were able to add an additional 164 ICU beds as of Sunday. Nakapagdagdag na rin tayo ng halos 3,000 beds sa iba't ibang mga ospital, isolation and ward beds at that. Kasama na dyan yung mga extension facilities na ginawa natin, katulad sa National Center for Mental Health, katulad sa Quezon Institute, katulad dun sa mga ibang mga mega facilities na meron tayo sa ngayon. And maganda rin ang nakita natin, itong mga level 1 hospitals, very willing sila na tumulong sa gobyerno natin, na maging step-down care facilities so that we can further decongest our hospitals. So looking at these 2 weeks na ECQ, masasabi natin that while cases are still rising and the healthcare utilization is still not at that level na masasabi natin safe tayo, pero nakikita natin na we are already improving on our capacity and we are improving on the response per local government. So hopefully we are expecting that in 10 to 14 days, we can see the decline of the cases.
Thank you, ma'am. Also from Greg po, aside from the AstraZeneca jabs, are we still expecting Pfizer vaccines from the COVAX facility, which was earlier committed? If so, how do we plan to use this while a new study in Israel says it's less effective against the B.1.3.51 variant?
Well, unang-una, so tama naman yung ating sinasabi, na sinabi din naman yan ng mga eksperto na merong sinasabing immune escape, which is a phenomenon which happens with this South African variant. At ito ay kinokonsidera talaga ng mga eksperto, lalong-lalo na yung mga gumagawa ng bakuna, para how they can be able to repackage yung kanilang mga bakuna for them para mas maka-adapt sa mga ganitong mutations ng virus. But with all of these things that are happening, our experts and even experts around the world and even WHO is saying, whatever the effect of this variant to our vaccines, we still continue to vaccinate. Continue to vaccinate because kahit ano pa hong efficacy na sinasabing binabawas na itong mga variants na to sa ating bakuna, meron pa ring natitira. And that, kahit kakaunti iyan, is still going to benefit the population. So we still proceed and continue on with vaccination.
Thank you, Sec. I'll be going to the questions po that were sent in the chat po from Greg pa rin po. Octa Research has flagged the increased case fatality rate in NCR, which is at 2.0.2% as of April 11, compared to 1.8 back in October. May we get a DOH reaction on this, especially now that we have scaled down the quarantine classification in the NCR plus bubble?
Yes, aligned naman tayo. Ang Octa Research naman, kumukuha rin sila ng datos sa atin sa Department of Health. And tama naman yung sinasabi niya na nakikita naman natin talaga based on our number of deaths for this past week, talagang tumataas ang mga numero ng mga namamatay. And ang ginagawa nga natin, and you say that because we have downgraded our quarantine classification, would it affect? Ang una nating gustong sabihin sa mga kababayan, na ibabaman natin ng kaunti itong quarantine classification. Yung safeguards na atin pong pinagbilin, and very critical among all of those actors na gumagawa nitong response ay dapat na andun. At ang pinaka-importante na nga dyan, yung healthcare utilization natin. So by expanding the number of beds in our hospitals, specifically by expanding our ICU capacity, we will be able to manage and treat more severe and critical, and therefore, hopefully, we lessen the number of deaths in the country, specifically in NCR.
Yusek, next question po. We're seeing more cases of SARS-CoV-2 variants in the country. Are there initial results or guidelines generated from the ongoing investigations with WHO? With most cases of new COVID-19 variants are local, and given the surge in infections, can we say now that we have community transmission?
As I've said, I've answered that a while ago. Yung community transmission, hindi pa ho natin yan masasabi. Patuloy po ang pag-aaral ukol sa mga kaso, kung paano sila linked to each other, at saka yung mga lineages nila at iba pa. And this is being studied together with the WHO experts. But for now, what really is the focus of the WHO experts is iayos muna namin yung genomic biosurveillance. So what do I mean by this? Yung sampling methodology natin, kung paano tayo kumukuha sa bawat region, linggo-linggo, sino dapat pinofocusan, ilan dapat, para makakuha tayo ng complete picture of what's happening in the country when it comes to variants. Isa yan dun sa major na pinag-uusapan natin with WHO. Pangalawa dyan, of course, yung transmission, at saka yung kapasidad ng variants, na mag-increase nitong transmission na ito at gaano ang extent nitong community o nitong transmission ng variants na meron tayo. So sabi ko nga, pinag-uusapan pa yan at mas pinag-aaralan. Working tayo with the surveillance team of WHO, we will give information as soon as we have this initial recommendations coming from the experts.
Thank you, ma'am. From Jenna Balaoro, how far away is Metro Manila or NCR Plus from herd immunity? Based po sa number of individuals na nabakunahan na, ilan din po ba ang dapat mabakunahan para magkaroon ng herd immunity sa NCR, NCR Plus?
Actually, Jenna, we're not so much looking into this herd immunity, especially in NCR. Kailangan natin tignan, kahit na magka-herd immunity ka dito sa NCR and we reach the 70% of our population here, very porous ang ating mga borders, no? So maglalabas-pasok pa rin ang ibang mga rehiyon dito, at even the NCR people can go in and out of NCR and go to other places. So achieving herd immunity here will not give us that much effect. Ang gusto natin, protection. Protection para hindi maglalala ang sakit at makabawas tayo at hindi dumami ang mga namamatay at nauospital. That is our objective for now. Why? Because these vaccines, sinabi naman talaga ng ebidensya at ng mga eksperto, hindi siya nakaka-block ng transmission. Pangalawa, wala pa hong kasiguruhan o wala pang sufficient evidence na sinasabi gaano tatagal ang immunity na ibibigay sa iyo ng bakuna. And of course, makikita po natin around the world, yung vaccine effectiveness na sinasabi, wala pa hong nakakapag-aral at may ebidensya niyan. So having said that, and with all of these points that I have raised, I think yung herd immunity is really a long-term goal of any country or any place for that matter. Ang ating objective ngayon, immediate objective, bawasan po natin yung mga namamatay, bawasan po natin yung mga nagkakasakit ng malala at nauospital. And that is what the vaccines will do for us for now.
Thank you, ma'am. A clarification daw po, pwede po ba gamitin na antigen rapid test kit sa bahay? And because these are already being sold online daw po. And if these are accurate po.
No, we cannot use rapid antigen test in our home, no? Hindi pa ho iyan pinapayagan ng ating regulatory process, no? Ang ating sabi, rapid antigen test should only be administered by medical professionals na authorized in doing this. And second, syempre, ito po ay kailangan nandun tayo sa isang lugar na appropriate din. At kailangan guided tayo ng ating mga medical professionals. Gagawin lang ang rapid antigen test sa guidance ng ating mga healthcare professionals. So, yun pong ginagamit sa bahay at nabibili sa online. Baka ho kayo ay magkaroon pa ng problema dyan and you will be misguided kasi baka bigyan kayo ng false result. So, mas magaling na lang po, dito na lang po tayo sa ating mga licensed laboratories makipag-usap at kumuha o magpagawa niyaan para po tayo ay sigurado.
Thank you, ma'am. From Jerome Morales, Sinovac released Brazil trial data which showed its vaccine is 49.1 effective when second dose was given less than 21 days after the first, while it goes up to 62.3 when given 21 days or more of interval. China is advising to give it with at least 3 weeks of interval and considering changing the number of doses. What is our interval guidelines and any changes given this recommendation from China?
Well, in any recommendations that is being given, it has to be forwarded to the Food and Drug Administration because the Food and Drug Administration is our national regulatory agency at sila po yung naglabas ng Emergency Use Authority kung saan doon po natin inangkor yung ating mga guidelines for specific vaccines that are being used right now. So kung may sinasabi po talaga na it is verified na ito ay galing sa pag-aaral na dapat lesser or more days of interval between doses, the manufacturers has to submit these evidences to the Food and Drug Administration so that our FDA can evaluate this based on the merits of the evidence together with our experts, and if found na okay naman at positibo at kailangan gawin, i-revise po nila ang emergency use authority natin. So we cannot just act on anecdotal reports. Kailangan po itong dumaan sa masusing pag-aaral.
Thank you, ma'am. In relation po to ECQ, Red and Caroline's question po, Red is asking, HPAC said na yung ECQ has been turned into waste dahil hindi raw nasunod yung mga dapat na reforms such as incident management team, integrated ICT law, and social safety nets. As well as from Caroline po, if what have we achieved so far in the past 2 weeks and how do we maintain it po?
Yes, no? So unang-una, hindi naman natin masasabi that it has gone to waste, no? Itong mga ginawa natin. Kasi unang-una, wala pa nga tayong sukat or indications, no? Kung ano ang nangyari nitong nag-ECQ tayo. Kasi katulad ng sabi natin, makikita natin ang epekto nito in the next 10 to 14 days. But let me tell you something. Alam niyo po, itong virus na ito, ang kanyang pagkalat o pagdami, exponential po siya. Diba sabi nga natin, ng isang tao, pag sa transmission rate mo na ganito, halimbawa 1, mas makakahawa siya ng medyo 4, 3, ganon. Diba yun sinasabi natin based on transmission rate. So when you look at that rate of transmission of this virus, it's exponential. So kung ganyan po yung basihan natin, titignan natin, baka kung hindi po tayo gumagawa nitong mga measures ngayon, we might be there, mas mataas pa sa 10,000 na average daily cases natin because of the exponential increase, no, rate of this virus on how they transmit. But because of what we are doing, we are trying to prevent, no, this kind of increase to happen. Now, I cannot say really, hindi ko masasang-ayunan ng HPAC dito na sinasabi nilang it has gone to waste because we have implemented measures naman na naandyan. We have mobilized our local governments. We have expanded our bed capacity. Yung iba pong kanilang nire-recommenda, katulad po ng mga interoperability ng ating mga sistema, pinagtatrabahuhan naman po yan. Pero hindi po yan matatapos ng 1 o 2 linggo. Kailangan po natin ng pagtatrabaho dyan ng medyo mas matagal. But that will happen. No? So, ang HPAC po, katulong po namin yan sa lahat ng aming ginagawa. We recognize yung kanilang mga rekomendasyon. And for these recommendations naman, ang ating gobyerno naman aligns with them and they align with us. So nagtutulong-tulong naman po lahat. Ito lang ang sinasabi na it's gone to waste. Hindi naman po. We are currently doing kung ano ang dapat gawin para maibsan natin itong sitwasyon. The next question of Caroline, what we have done so far, nakapagsabi na ako kanina, no? I've enumerated, we have expanded beds. We have an additional 164 ICU beds across the different hospitals in Metro Manila. Meron po tayong karagdagan na 2,200 plus isolation beds, and ward beds, and isolation beds about 700 plus beds. So in the whole, meron ho tayo na dagdag na mga 3,200 plus na mga kama dito po sa ating mga ospital. Wala pa po dyan yung ICU beds. Pangalawa po, ang mechanical ventilators at saka yung mga nasal cannulas, yung procurement po natin ongoing dyan, pero nakapag-distribute na po tayo sa iba't ibang mga ospital natin. PPEs as well, we have just distributed PPEs to all of our hospitals at marami pa po kaming kasunod para bigyan sila para regularly po napapalitan natin at nare-replenish ang kanilang mga supply. So ito pong pondo ng ating mga ospital, dinagdagan pa ho nung 1 linggo, nagbaba tayo ng additional funds for hospitals so that they can be able to procure other resources na kailangan para mag-manage ng ating mga pasyente. And lastly, ang local governments po ay kinakausap araw-araw, no? Especially the Metro Manila mayors, para makapagtulungan tayo with them kung ano pa ang dapat nating gawin. So this incident command in each city or municipality, especially here in Metro Manila, meron sila ng mga emergency operations center po nila. At dito po nagkakaroon ng triaging para ma-break natin yung chain na ang mga tao dumidiretso sa ospital and to further decongest our hospitals.
Thank you, ma'am. An update daw po from Caroline, where are we po in contact tracing?
Well, for contact tracing, based on the reports that has been presented to us last Saturday, nakita natin na may improvement naman sa contact tracing. Although we are still averaging 1:6, 1:9. No? Yun yung average ngayon ng ating mga local governments. But of course, improvement will be nandiyan na yung improvements na mangyayari dahil ang Department of Labor and Employment through their TUPAD program will be providing additional contact tracers to our local governments. Meron din pong hinahire uli ang DILG para madagdagan itong mga contact tracers, and the uniformed personnel are already helping. So lahat-lahat po yan ay magiging integrated, no, para po magkaroon ng additional contact tracers and we can be efficient in contact tracing. Another thing na gusto ko lang ipagbigay alam sa inyo, stay safe, ay pinag-strengthen ng ating gobyerno at uumpisahan na po natin talagang magamit sa bawat establishmento and of course in the community.
Thank you, ma'am. In relation po to what you have answered a while ago, the question po of Rafael Bosano, can the DOH categorically say whether or not there are enough health workers for every additional bed? May update na po ba sa hiring ng karagdagang health workers lalo na sa panahon ng surge?
Ngayon, Rafi, yung meron tayo, no, yung deployment. So, nakapag-redeploy tayo ng mga tauhan galing sa iba't ibang region at dinala natin dito sa ating mga ospital sa Metro Manila. So, that happened last week. About our emergency hiring, patuloy tayong nag-hire through our different hospitals. Marami na rin po kaming nakukuha na nag-a-apply din through the central office para po makatulong dito sa ating sitwasyon, and we will be deploying in the different hospitals. So tuloy-tuloy po tayo dito sa hiring na to dahil alam nating critical itong mga healthcare workers sa ating response.
Thank you, Yusek. Next question po. According to Secretary Galvez, the Sputnik V vaccines from Russia is in ampules and not in vials. Is there a need for retraining our vaccinators to familiarize them with the ampules?
Hindi naman kailangan ng retraining. Ito pong ating mga bakunador, bihasa na po sila, whether it be vials, whether it be ampules, alam na po nila kung paano ginagawa yan. Pero sa lahat po ng bakuna na ginagamit natin dito sa ating bansa, meron ho talagang specific guidelines na pinapalabas so that our healthcare workers are also instructed properly. So the training will not really be an issue or something that will be needed, but the guidelines and the protocols has to be there so that they can be overseen kung paano natin gagawin ito.
Yusek, from Joyce Coliante, sa ibang bansa po like UK, umiikot po ang mga ambulance nila para magbigay ng oxygen therapy sa COVID patients na hindi na kayang i-accommodate sa hospitals. May plan daw po ba ang DOH na i-recommenda ito sa LGUs?
Meron naman po talagang gumagawa na niyan sa ngayon. Nakikita na natin yung mga anecdotal reports that ambulance services, especially the private ones, are providing this. Pero kailangan natin intindihin ang konteksto nito. Ang oxygen therapy, hindi naman yan isang oras lang tapos ka na. Tinutuloy-tuloy yan. So kailangan natin pag-aralan maigi itong proposal na ito because we're just like recommending na kailangan may mga mobile hospitals na tayo. So pag-iisipan din yan, kasama yan sa lahat ng plano. Pero sa ngayon, sa tingin ko, hindi yan sustainable for now.
Thank you, ma'am. From Codef Macon of the Business Mayor, pwede po ba malaman if saang mga region po na-detect ang each new variant sa latest sequencing ng PGC?
Claudette, bibigyan namin kayo ng table, no? Mahirap natin isa-isahin dito. Pero alam naman na ipakita naman namin dun sa ating PR kung saan-saang regions nandito yung mga variant. Sa ngayon kasi, we are still trying to continue verifying some of the data so that we can have complete details. But for now, ito munang mga regions sa pinapakita namin.
Thank you, Yusek. From Aiko Miguel po, sabi po ng WHO, kailangan pa rin magpabakuna kahit ang mga naka-recover na sa COVID-19. Mas maganda raw yung may natural immunity na at may bakuna pa. Bumababa daw kasi ang bilang na antibodies o kakayahan ng natural immunity na labanan ng virus habang tumatagal, kaya kailangan pa rin magpabakuna. Ano po ang kasalukuyang pananaw po dito ng DOH and ano pong advantage at disadvantage sa isang COVID-19 survivor na magpapabakuna pa rin?
Ano naman yun? Kasama ho yun dun sa ating basic course of the disease, no? Na pag nagkakasakit ka, nagkakaroon ka ng antibody sa iyong katawan. Pero katulad ng ibang sakit, itong sakit na ito, kapag nagka-antibody ka, hindi din siya tumatagal. Although there is still no sufficient evidence yet to say the exact duration of time na nagtatagal itong mga antibodies mo because you got sick. Kaya nga, ang payo pa rin, tuloy pa rin ang minimum health protocols kahit nagkasakit ka na. Pangalawa, kailangan ka pa rin magpabakuna para nabuboost mo pa rin itong antibody production mo so that you can have a better immunity against this disease.
Thank you, ma'am. From Caroline po, a clarification. Ano daw po yung 1:6 ratio ng contact tracing? Is 1 case is to 6 close contacts found?
Yes, tama yun, Caroline.
Thank you, ma'am. From Aiko Miguel, last Friday, record high po ang death cases, and although madami po ang patients na naitala sa NCR, lumalabas po sa report na most death cases came from Region 3 and 4A. Saan po natin pwedeng i-attribute po ito? Case management po or ibang factors po po?
Marami namang factors lagi pag may namamatay, di ba? So, kailangan natin tignan ng isang kompletong analysis pag may mga namamatay na tao. Una-una, meron tayong tinatawag na demand factors, and the second would be supply factors. Demand factors would be the patient themselves. Kung meron kang delay in your health seeking, dito sa dapat natin pupuntahan ng mga facilities, baka doon tayo nagkakaproblema. Pag nagkaka-delay tayo sa health-seeking behavior ng isang tao, marami pa rin factors na tinitignan dyan. Naandyan yung finance, may pera ba? Baka pag walang pera, mas discouraged na magpapatingin. Second, access, di ba? May access ba tayo? Baka naman nakatira sa pangalawang bundok pa at bago makarating sa ospital ay napakalayo. Di ba? So, this kind of factors has to be assessed also. Now, when it comes to the supply factor, katulad ngayon, nakikita natin yung mga ospital natin, di ba, punong-puno yung emergency room, yung mga beds natin, hindi pa ganun kadami. So, maari rin, no, na isa yan dun sa nakikita natin mga factors. Kaya nga, pag nakakakita tayo ng ganyang analysis, we need to address all of these things. And primarily, kailangan mo i-expand yung bed capacity natin so that we can accommodate more.
Thank you, ma'am. Last question po from Catherine Gonzalez. You mentioned daw po in a television interview this morning that the results are already from the expert's evaluation of Ivermectin and kailangan na lang daw po ito i-finalize. Meron daw po ba tayo expected release ng results of the evaluation na Ivermectin?
Well, the Living CPG had a meeting last week, no? And this is continuous yung kanilang evaluation. And base dito sa mga pagpupulong na ito at pakikipag-ugnayan ng mga eksperto, nakita naman natin na almost complete na yung kanilang evaluation. Nagpa-finalize na lang sila. So antayin natin sila maglabas, maybe this week or the coming weeks. Pero alam naman po nila na ang request ng Department of Health is ASAP. So antayin natin, baka lumabas din this coming days.
Yusek, last na lang po from Rafael. The NCMH in an advisory last April 6 said that it's allocating 1,260 beds for COVID patients despite admitting that it doesn't have enough capability to treat serious illnesses like the disease. Some staff are also worried na maapektuhan na kanilang pag-alaga sa mga psych patients, lalo na sila rin daw po ang ibababa sa COVID beds kahit na hindi sapat ang kanilang kakayahan to respond. May mga staff din po na takot nang pumasok ulit. Magdadagdag ba ng staff sa NCMH to man the additional beds for COVID? How can you allay the fears of the staff from going to work po?
Yes, no? So unang-una, ang NCMH po ay naitalaga na paglilipatan ng mga mild to moderate cases. No? So we are not going to manage severe cases in this facility that has been established to extend our capacity. Pangalawa, alam po ng gobyerno yun. We recognize the fact na pag naglagay tayo ng extension facility, hindi rin tayo magdadala ng supplement or augmentation in health human resources. So isa ho yan sa pinagtatrabahuhan ngayon para madagdagan natin ang healthcare workers natin dito sa NCMH. It is not the objective of government na sila na ang nag-aalaga dun sa ating mga pasyente na talagang karapat-dapat sa NCMH like our psychiatric patients ay mapupunta pa sila dun sa COVID because hindi na rin tayo magkakaroon ng infection prevention and control. So kailangan maintindihan po, hindi ho natin paghahaluin ang mga taong to na ilalagay natin sa mga COVID wards at yung mga talagang nagbabantay po dun sa ating mga kababayan na meron hong mga mental issues.
Yusek, from Lay po, bakit di pa rin approved ang remdesivir sa Pilipinas for COVID-19? Sa US daw po kasi approved na ito.
May clinical trial na under going ngayon ang remdesivir, 'di ba? Kasama siya doon sa solidarity trial ng WHO. So until we can finish this clinical trial, we will have enough evidence and we can do that. Another thing, para magka-CPR or magka-emergency use authority or drug emergency use na certificate or authority from FDA, somebody has to apply. Diba? So wala pa naman ho tayong nare-receive. Parang last week nagsabi si Yusek Domingo may isang nag-apply for this drug. So antayin natin yan para magkaroon siya ng authority para mas na-distribute din siya na mas maayos.
Thank you, Yusek, for accommodating all of the questions. We have now reached the last part of our media forum. Ma'am, your reminders po to the public through our media partners po.
Yes, una-una nagpapasalamat po tayo kay Yusek Rose Edilion from the National Economic and Development Authority dahil naipaliwanag niya po sa ating mga kababayan and even with our media partners the A4 priority list. Gusto lang ho namin magpaalala galing po sa gobyerno sa ating mga kababayan, sana patuloy po ang ating ginagawa para maibsan po natin at maging maayos itong response natin against COVID-19. Pangalawa, patuloy pa rin tayo yung efforts natin for vaccination ay naandyan. We are trying to ramp it or speed it up. Gawin nating mas mabilis para mas marami ho tayo maprotektahan. Gusto ko lang hong bumalik sa objective ng ating pagbabakuna ngayon is to protect the most vulnerable. Gusto ho natin maproteksyonan agad-agad so that there would be less severe forms of the disease, less hospitalizations, and we can avert number of deaths, mabawasan po natin yung mga namamatay sa ating bansa. So gusto ko lang hong ipaalala din, marami na ho sa ating mga kababayan naka-receive na ng second dose or even first dose pa lang ng bakuna. Hindi po iyan passport para hindi na tayo mag-comply sa ating mga minimum health protocols. Kailangan pa rin ho natin magpatuloy ng pag-comply dito sa mga sinasabi nating pagsusuot ng mask at face shield, physical distancing, huwag pupunta sa matatao at enclosed spaces, at palagi ang mag-uugas ng kamay. Bukod po sa ating patuloy na pagbabahagi ng wastong impormasyon sa ating mga kapwa, paghusayin din po natin ang ating pag-iingat upang lubos ang proteksyon ng ating mga tahanan at ating mga komunidad. So with that, I'd like to thank all of you and see you all on Wednesday. Thank you, Nick.
Maraming salamat po. Ingat, Yusek.